So guys, I'm just really excited. This is not an official video. I just want to say, if you're preparing for Osce exam and you are writing soon, guys, the exam is really simple. So please, I just want to say this to you: don't get worked up, don't get anxious, don't allow people instill fear in you and like say, oh, Osce is hard. Trust me, Osce is very simple and nurses are very brilliant. So you'll definitely be successful, okay? So what I want to say quickly is it's not out of place. Take note, it is not out of place for your assessor to make you wear apron and glove before starting. That means you've not started the exam, but as you are entering to start the exam, they make you wear apron and glove already. That's not out of place. If she makes you wear apron and glove before you start your station, before you even enter to meet her, that's fine. All you need to do is, as soon as you enter, remember I've told you severally, guys, they are going to be telling you assume more checks are done. So assume more checks are done means since safety has been done, privacy has been provided, but make sure you do your hand hygiene. All right, so just make sure you do your hand hygiene as we used to. Make sure you do your hand hygiene. So even with your glove hand, still do your hand hygiene, except of course your assessor tells you don't worry, proceed. But with your glove hand, still make sure you do your hand hygiene. The only thing is that you will not apply gel, so just still make sure you do your hand hygiene. All right, approach your patients as usual. Just try to be confident. Just be confident. Even your assessor wants you to pass. And I remember I've said this to us: if you are doing news, whether you are doing the old Osce or the new Osce, make sure you check your news chat 4 times. All right, because sometimes at the end of the day, after finishing the exam, you begin to receive emails telling you that you did not sign or you did not chat properly. So just make sure you chat your news you check your news chat 4 times. Like recently now, the patient's name is already inputted for you in your news chat, but make sure you check. And like we said, we are using scale 1, so stick to using scale 1. Now for those writing the new Osce, for evidence-based and professional values, I've said it severally, guys, is strictly according to your marking criteria. All right, so make sure you write it according to your marking criteria. Write it strictly according to your marking criteria for evidence-based and for professional values. All right, then if you are doing blood glucose, don't be scared. For blood glucose, make sure you remember to record your blood glucose. A lot of people have asked for blood glucose video. I just might do that today. It's just that I've been very busy. All right, so make sure you remember to record your blood glucose value, because some people are beginning to forget and getting result like, oh, but I did it well, oh, but you didn't record. So just remember to record. All right, just try to do the most important thing. Yes, trust me, try to do the most important thing and strictly according to the marking criteria. Like, avoid things that will waste your time in the exam. Things that waste your time and is not included in the marking criteria, like asking a patient what do you like to be called, is not part of the marking criteria and is a time waster. Yes, so all those times are times you should preserve. Oh, what do you like to be called? You don't need to ask the patient that. Once the patient has told you their name, you can either call them by their name and move forward, so that you can minimize time. Avoid time wasters like, do you want to use the washroom or do you want to use the restroom? If you are not very good with them, avoid such time wasters. Just introduce yourself, tell them why you were there, then you proceed. All right, so don't be scared at all. Don't be thrown off balance, okay? It is really simple. So to those writing this week, oh my god, I can't wait to congratulate you. Definitely, I can't wait to congratulate you. Now, if you're doing your ANTT and you happen to make any mistake, please verbalize it. Assessor, I just noticed I've contaminated my trolley or I've contaminated my pack in a reclinical setting. I'm supposed to get a new pack, and and I'll start all over again. Of course, they wouldn't let you get a new pack and start all over again, but at least you've said it, okay? So remember to double check your patient's name and date of birth before giving your patient your medications. And remember, if you're giving antihypertensive, ask them of their blood pressure. Now this reminds me, if you assess, or if probably you are doing implementation and you ask for the blood pressure and your assessor tells you is within clinical limits, please remember to give. All right, but once the assessor tells you is within clinical limits, remember to give. And what if you're doing implementation and you're giving like a drug like not the pain, and the assessor tells you, and you ask the assessor like, what's my patient blood pressure, and the assessor tells you it's 110/70, and you're like, oh, it's quite low, I'm not gonna give, and the assessor tells you but the doctor wants her to have it, you can also go ahead and give. All right, right? Remember, for implementation, they want to check your competency with administering medication. All right, and if you're not giving a medication for a reason, a clinical reason, remember to code it, and remember to also go to the back and write it under drug omitted. So guys, those writing this week, like I know a lot of people, a lot of my subscribers are writing this week, like I already like 60, like and as I'm writing this week on my pray for me. Oh my god, I wish you a success. I can't wait to congratulate you. All the best, guys. I can't wait to start reading mails this week. Like I passed. All the best, guys. Go and do exploits. Go and be successful. I love you all. Bye.